Mr. Greer, I just sent her. You're on. Hi.
Hey.
You were like waiting for me. I got all set up and then realized that my kid took my ring light apart to use for a light box. So that was awesome.
Oh, right. There's always a
It's
snag.
right here. Yeah. It's fine. And the screw's missing, of course. Whatever.
Well, I need the light box because I did a chemical peel on Friday and my face, you can't really tell.
Very flaky.
You get close. It's coming off. It looks really horrifying in person.
Isn't that fun? I'm all red because I have a raging cold and I've blown my nose like 100 times today.
Oh, perfect. Yeah.
I know. And the best is when you're scrubbed in the OR and you're like, my mask is full of snot. This is amazing.
That is hands down one of the worst experiences. So, yeah.
So gross.
Mm-hmm. So, let's see. I have to start this off being in San Diego with a Go Padres. Not even like the crap about baseball, but
I don't either. But apparently the Guardians are doing okay now.
Okay.
I don't know. I was out to dinner with someone on Saturday, and everybody's cheering, and we're like, "Oh, baseball! Is this important?" I Google. I'm like, "Oh, okay. If they get through this, and then the next one, then they can go to the series. All right."
Okay. Yeah. No one thought the Padres would make it, so it's a big deal here. And then someone was telling me that the game in Seattle Saturday night went 18 innings, which underscores why right. That's
right. And then there's going to be another game the next day. Awesome.
Yeah. Kill me. Yeah. Anywho. So that's my baseball update. But
fantastic.
We were going to talk about post-op stuff, right?
Yeah, like swelling, compression garments. I think we should talk about icing too, because people ask me about this all the time.
Okay. What's your take on icing?
I hate it. Like everything's numb. Don't do it. It's just they always want to do it for lipo or for facelifts. The whole area is numb. I've seen people give themselves frostbite.
Okay.
I do have people do it for blasts.
I want to know who Revision Bob is.
I don't know.
Oh,
I'm gonna go with rep. I'm gonna guess.
Yeah, I don't tell people to ice lipo. That seems weird. The only time I advocate for ice is for breast surgery, like breast augmentation, because I do, under the muscle, and I feel like it really does hurt, and it feels better to have ice packs up here.
Now, do you wrap them after aug? Because I always wrap with an ACE wrap, and then I'm like, well, you're not going to feel the ice through the ACE anyway.
Oh, no, I just put them in a bra.
Oh, okay.
Bra. And honestly, I feel like you can ice way longer than the immediate post-op period and still get, it's kind of like icing a sore muscle. It makes sense to me because it's your muscle.
Right. So it's decreasing inflammation.
Mm-hmm. Yeah. So I do like ice for that. I've only seen somebody get an ice injury once from icing too much, but that was it was a reconstructive case, melanoma on the foot. The guy he had surgery, had a flap, and then he iced it and was a ding dong. It worked out fine, but also risk factor was that he was a doctor, so you know how we do.
We always have complications. It's a rule.
Yeah, I mean, you don't need to tell me that after 10 minutes I should probably take the ice pack off because I'll be numb and I won't be able to tell if I'm, So anyway, yeah. So, and when you do ice, I do tell them 10 minutes on, 10 minutes off at the most, because you will go numb and then you won't know what you're doing.
Yeah. So, and then you injure your skin.
Yeah. So, okay. Yeah, ice on your face, I don't recommend that either.
Is that your dog growling?
Yeah, she's growling.
Okay. I was like, is my house, like, do I have a poltergeist?
No, she's growling because somebody walked past our house and we're on the second story, so I'm not really sure what she's accomplishing by barking at him from the second floor.
That's awesome. They are already very far away. Yeah, my cat's just sleeping in a chair today instead of trying to knock my phone over, so that's a win.
Oh yeah, that is. Okay, are we done yelling at the people outside? Okay, good. Okay, so ice. What about heat? I mean, it doesn't do anything, but I feel like it makes people feel better. But again, the risk is that you can burn yourself.
Injure. Yep. Yeah, I never specifically recommend it. Sometimes if somebody has more like muscle spasmy stuff, but I'm trying to think when that would happen.
Yeah.
Yeah. You know, the time I do recommend ice is Mondor's. which is when you get thrombophlebitis of one of the blood vessels in the breast, and it feels like a little cord. So I'll have them do ice and Motrin.
Yeah. Yeah. Okay. So we're off ice and heat. What about compression? How do you feel about garments?
I do like compression. Oh, there's Elise from my office. Hi, Elise. Yay. I do like compression. I know some of our colleagues don't use them, but when I had lipo, it just felt like everything was like all loose and not contained. My only annoyance is that they don't fit everyone very well. When they fit well, they're great. When they don't fit well, they're just an annoyance.
Yeah. I mean, if there weren't already 8 different companies making garments, I would design my own garments because they really do such a terrible job of like making garments that fit people that would work. I mean, the bras are pretty self-explanatory. I put people in a light post-surgical compression bra after surgery, but for
like the torso garments, like some people have really long torsos, and it just like they can be the shortest person.
Petite, and I feel like everybody's garment comes up to like here instead of stops where it needs to be, and then it folds over.
And it digs in. I always send them home for lipo. I'll do garment with a binder over it, and then if the garment's really uncomfortable, I just have them stop that and just do the binder.
Yeah, I know. I would do a binder, except I also feel like it's the same problem. It either rides up or you can't pull it
wrinkles
down.
And folds. Yeah.
So I end up putting people, if I do liposuction to the torso, they end up in like almost like a girdle, right? So it comes down below and you're like, well, you don't need anything on your legs. We didn't do that. But the only alternative garment is the kind that is like a lower bodysuit leotard. But in order to do that, you have to like clasp it underneath in the crotch area. And
so those are actually the ones I use. And I know the patients hate the crotch naps at first, but they loosen up after a couple of days.
Yeah, you can do it.
I spoke to shit on the cat. Because so when I had lipo, that's what I had, and like you get pretty adept at them, but it takes about 2 days. So I just tell people to leave them unhooked for the first couple of days.
Oh yeah, that's not such a bad idea. Yeah, people just hate bending over to get to it, so I just put them in.
It is hard, but then there's the shorts are crotchless, right? They have like the cutout. See, that's weird too. And probably
people do and do not like that.
Things ride up in weird ways, and then just. TMI, but then you go to the bathroom and you're like, did I pee on it?
Yeah.
Did I not?
Everywhere.
Yeah, it's great. So he's in the room with me and he's like, what are you talking about?
Oh. Crotchless garments. What?
Yep, crotchless garments. This is what we talk about professionally.
Funny fact though, I went to I was at the conference in San Diego one year, and a friend of mine, or actually like anyway, she was an acquaintance, but she's a GI doctor, and the GI people were having their conference in the convention center at the other end. And so I met her for lunch because she lives in like Minnesota. And she's like, I heard that in your exhibit hall is crazy. I'm like, it is? And she's like, yeah, I heard there were women running around in their underwear. There's women in their underwear. And I was like, what? No. Oh, the garment girls.
Oh, that's funny.
Because they had like Marina models that year like on pedestals wearing garments, and they had these crazy wigs, and it was this whole to-do, and I was like,
oh, that is
I was like, come on in, we'll go scope it out. You can see the you couldn't pay me enough to wear those. I don't care how cute you think you are.
That's funny.
Yeah, here's the crotchless garment that I have to wear, but I'm going to wear stuff
with some underwear under it.
And a blue wig. Maybe no one will notice.
Hi, that sounds fantastic. Yeah, they probably got paid really well. I hope.
Oh.
Yeah. So, I mean, I always found it more comfortable wearing a garment. Like, I liked wearing the garment because otherwise it just felt really unsupported and really uncomfortable. But I know other people don't use them at all. And so I'm not too worried about it if somebody's like, it's really uncomfortable. I'm like, fine, take it off. We don't want chafing. We don't want irritation, or just do the binder, or go get some Spanx.
Yeah, I do tell people Spanx is an option if they hate it. It's hard though, because I feel like it does get the swelling down faster. So if you just did liposuction and let them walk out the door, they're going to go poof. Poof. So it is really nice that I tell people to try and stay in compression around the clock for 2 weeks, except for when you shower and or you're washing said garment.
Oh, and you're nicer than I am. I tell them 4 weeks.
Ooh, And then I tell them it's a good idea to continue to wear it, but I need that 2 weeks. And then after that, some people really like wearing it for a long time.
Provide support. To work out. Well, that's where I'm more easygoing. If it's irritating or annoying them, I'm like, fine, take it off. Don't worry about it.
Right. Yeah, I can't not using one, but I do understand from the surgeon's perspective, it gets away the headache of like, does it fit right? Is it bothering them? Are they getting chafing?
Right. And I always measure for mine, so when they don't fit, I'm like, oh, that jerk who measured.
Yeah.
And people always ask, like, how do they end up in their garment? Like, we put it on you while you're asleep. We're really good at addressing unconscious people. You're welcome.
Yes.
As long as it's got like hook and eye closures and zip up on the side, then we can do that.
You just have to start your side first. It's really.
Yeah. I mean, my team is like so smooth at the garments now. Like, they lay a towel. So we have to roll you over, tuck your garment under, roll you over on the other side. If you've ever seen people make a bed under an unconscious person, this is how we do it. But like, my nurses work with me all the time now. And I realized my circulator, Megan, one day, I'm like, wait, you're rolling up the towel so I can tuck it from my side, regardless of what side of the bed I'm on. She's like, yeah. So it always goes on the same way. And then if I'm on the wrong side, like the hook and eye closure is suddenly very hard.
Yeah. Because you get used to your system.
Yeah.
No, when I was in training, I worked with a nurse who could you pulled the bra over because there's 6 clasps, and she could get them all. It was so amazing. I've never been able to replicate that.
I feel like we should try that at ASPS. Or you're going this year. We should just bring a bra and practice. You have to fold it. Like, you have to fold the under part because otherwise,
get it out of the way. Yeah, it was impressive.
Amanda says it'll be me next Monday. Girl, we're gonna have fun.
Get you in that garment.
I always wonder if people have weird memories of us dressing them as they're waking up.
I think people are just the next day when I see them, they're like, how'd you get me in this? I'm like,
magic. I mean, we're like rolling them around.
Magic.
We're like lifting
You're
them
asleep.
up.
Yeah. My oldest daughter dances, and she's been in the Nutcracker every Christmas. And it's a production with the company ballet, so the city ballet. So I've helped backstage. And there's quick changes, and then sometimes you're just hanging out, just trying to be helpful. And the actual company ballet dancers come back, and they literally have seconds to change. And I'll just be there, and I'm like, oh, I got this. And it's dark, you can't see. It's like a whole other different challenge of getting those hook and eye closures. Wow. Except it's usually some sweaty, very well-toned, gay man.
I mean, that sounds fabulous. I can't think of anything more fabulous than putting a gay man in a leotard in the dark.
Yeah. It's their coats and stuff for all the Yeah, it's funny. But it's the same nonsense, and they'll be back there with a little iPhone light so that we can see what they're doing. And the thing is, at the same time, they're not just standing there letting you dress them. They're trying to switch their socks or their shoes or whatever. Oh my gosh. Crazy.
Hey, Amanda, how are you? We're getting lots of highs today from all my patients.
So I feel like those skills translate into more than one setting.
I always tell people, if you need help, dressing a dead body, call a plastic surgeon. We're really good at it.
Yeah.
And then I'm always afraid somebody I know will turn up murdered with a change of clothes. And they'll be like, who mentioned this on Instagram last week? It was Dr. Greer.
Yes. Yeah. We just need to put this outfit on.
Yep. It's fine. Very helpful.
That's awesome. All right. So that's compression. How do you feel about foam? Do you use lipo foam?
I was going to ask you. I do like top of foam. I do. I don't use it on everything, but I'll use it on my tummy tucks and where I lipo. And when I started using it, when I stopped using drains on breast reduction and I switched to doing superior meatal pedicles and I do aggressive lipo in the lateral chest, I started putting top of foam in the lateral chest and wrapping it with an ace wrap because I had a couple seromas. Boom.
Oh, that's a good idea. I haven't had a seroma issue, but I always tell them if you liposuction here and right in here, which everybody likes to have done, there's not a great way to get compression on that area. And so the bra sits there, but then everything bulges up, and
the foam definitely helps.
Definitely helps.
And Dana said it makes it more comfortable. So I do like it.
I might add that in.
Because it kind of it pads like the chafing areas. I keep some in my office too, and then if people have seromas, I'll put it under. Okay, good to know, Dana. Thanks. I'll make sure I liberally apply Topifoam more often.
So do you put Topifoam on for your tummy tucks too, or no?
I do. I'll just put one sheet right on the front. I just feel like it adds a little extra padding. And then if I do lipo on the waist, I'll put another full sheet on each side.
Okay, nice.
Yeah. You just got to be careful that there's no ridges. I one time had like a little space in the center, and this person got a ridge of swelling, which drove us both bonkers for quite a while.
It takes a while to go down.
Mm-hmm.
I like the foam because I do lipo the sacral area, like a little right there.
Yeah.
That's nice because that area swells up. And then do you use the foam with the adhesive or no adhesive? Because I
use the adhesive.
Okay. You're in the Midwest, so I feel like I had somebody with I used Topifoam at one place when I was a couple years ago, and they're like, oh, here's a sticky foam, and I was like, oh, this is awesome. It sticks where you put it. And then like 2 days later or a day later, I peel it off, and she had like hyperpigmentation from the adhesive.
Oh, really? Oh.
Then, I mean, it eventually goes away, but it was a drag. So I'm like,
I've not seen that.
I get a lot of ethnic skin. Not, it's not straight fits too. So people have a little bit of color and everything I have people who have like the drain has to feed up and out of the garment, and you can see the imprint of the drain.
Line from the drain? Wow.
Mm-hmm. Yeah. I don't know why.
That's
maybe we tan too much in San Diego. Maybe that's the problem.
I mean, we don't have sun in Cleveland, so I think that really helps. There's none. It's just cloudy all the time.
Yeah, so I was always, and it's funny because I used to put Dermabond on everything, and now I tend not to use it as much too. Like anything that I think, also Southern California, maybe we're just all really sensitive, we're gluten-free down here.
Yeah, very delicate flowers.
Yes.
Probably vegan. I don't even know. I'm in the Midwest, we eat a lot of bacon. And beer.
Can resist things like adhesive and Dermabond.
Yeah, we do fine. I put Pretty on everyone. It's great. Actually, I Dermabond my blephs. We talked about this, I think, during the bleph one. Yeah.
Yeah, awesome. I have a very sensitive skin population. And it sucks when you have an allergic reaction to something.
It's annoying. I mean, I do get allergic reactions. It's usually Neosporin. Somebody's slathering that on. People don't use Neosporin. Don't use triple ointment. Don't use polymycin. They all have neomycin in it, and people are allergic to it. And then you get a big itchy rash, and then you get annoyed.
Yes. I feel like I was in a Facebook group where somebody asked about something related to putting Neosporin on it. And someone was like, I just came here for the comments from Plastic Derm that they're going to go crazy.
They have like a little popcorn eating emoji. They're like, here we go.
Yeah. Waiting for Plastics and Derm to weigh in about how much they hate Neosporin.
I love it. Well, I have a funny contact dermatitis story. So, I got my nose pierced in June, and then I got like the little piercing bump. So I'm like, I'll go on Amazon and get something to settle that down. And of course it was like some botanical calendula, whatever. So I put it on. It gets a contact dermatitis. So I'm like digging through my cupboard, and I find like a post-procedure cream which has hydrocortisone in it. And I'm like, cool, I'll slather that on. Then I got a contact dermatitis to that. So it just was like a bigger area.
No.
Yeah.
Cortisone?
It was probably whatever the carrier
cream
was, or like one of the scents or whatever, and it was probably like hyper irritated from the first stuff. So then I finally called myself in like triamcinolone ointment. I was like, screw this, I'm getting a prescription steroid cream.
Oh my gosh,
it was awesome.
That's always fun when you get something. I had a back spasm probably like 2 years ago or so. I must have been pre-COVID, and I was dying, and my chiropractor is like, I know somebody will come to your house and do a massage. So she does a massage, and then I ended up having an allergic reaction to the
massage oil,
which I'm not allergic to anything, but that was true misery because I showered after, and I started to not feel very good. I took a bath, whatever. And then I went to bed, and then I woke up at like 2 a.m. and realized what it was. Like I was because I felt awful. And then I was like, maybe there's a remnant on me. And so I got up in the middle of the night to try and shower and get any residual oil off of me. And I fell like I was a mess. And then my husband's like, what are you doing? It's 3:00 in the morning. And I'm like, reaction. It was like itching. My face was like puffing out.
Oh my gosh. It's like when you get a full body sunburn and you just feel sick like you have the flu.
And by that time, my lips were big, my tongue was swollen, and like,
you're like, I need a mineral dose pack stat. Oh.
I was like, man, now my back still hurts and I have a new problem. That's why allergic reactions suck, because they're like usually in response to something that you're trying to fix. So no good. So yeah, I think that's kind of all the post-op care. Like the idea is to make your recovery better, but
not more miserable.
Start to dodge things that are miserable. But drains sometimes a necessary evil, right?
Sometimes.
If you have to use them, try not to use them because of that, but it's better than all the things that come with post-op.
Although I feel like things have really changed a lot. I mean, even in the 10 years I've been out in practice, I send everybody home now. I used to keep tummy tucks overnight. I used to keep breast reductions overnight in residency. We did.
Right.
And like every breast reduction got a drain in residency. I stopped that out and like people do great. It's much easier without it.
Yeah, absolutely. Yeah, I used to, when I started as staff, you're too young to know that they had this pizza board thing. Have you ever seen that where they
that they put on the abdomen?
No, they put the patient on this metal board and then they ace wrap their chest and then they slide it out.
We still have one at the hospital. There was another doctor who liked it. And they're like, do you want the board? I'm like, God, no. Why don't we? No. And they're like throwing talcum powder on there.
I was they invented this thing called a bra. Why?
I mean, so I still wrap, which I started wrapping for the seromas with my reductions. I do, so I do a bra and then I put a 6-inch wide double length ace wrap
over the bra.
Over the bra. And I started doing that. How do we get them up? So I just have one nurse on each side and they lift their arm and head behind their shoulder. Like they just put a hand behind their shoulder, and that way you only have to lift them up a tiny bit because that board you're like sitting them up. Right. So my nurses just lift them a little. Although it's funny, I have this one anesthetist, Sarah, and if it's a bigger patient, she'll like put her head to the patient's back to hold it with her head.
Because then you just get it wrapped like twice or something.
On the smaller people, it's like 4 times, but. But I think it does help a little bit, especially with that armpit swelling from hogs, because it tucks right up under there. So I just do all my breast cases because it's simple and nobody has to think that hard then.
And then when you take the ace wrap off, when?
Day 2, when they shower.
Okay.
And so then they take the ace off, and then they just do the bra.
Okay, yeah. So that was the thing, like you're putting people in a couple of ace wraps, then they come in a couple days later, so you take it off, like, are they going to re-ace wrap? Like, they're having to re-ace. No, I'm not your patients. I'm just saying.
But like, are they supposed to? Yeah, no. So I don't have a re-ace wrap. But, somebody I trained with in residency when I was a resident, they were attending. Do you remember like the big fluffy cotton that goes under calf, like the bulky?
Yeah.
He'd wrap that around them. Then he'd put an ace. It's St. Louis. It's 110 degrees out. It looked like the itchiest thing to me. But, I mean, he would have gotten a million calls, so it must have been fine. But it was just like...
That's a plaster, like plaster.
It was like, they had this. They had on-cue pumps. They were all wrapped up. It was... I don't know if he still does that, but it's pretty funny. It was just a lot of fluffiness.
That's crazy. The ace wrap's a good idea, though, I guess, if you're got a lot of aggressive lipo.
Yeah, I mean, like I said, it helped with the seromas, and now I just do it on the breast because then it's easy. I like to keep things as consistent across cases as I can, so it's easy for the team and it's easy for me.
Right. They don't have to be like, is this the breast where we do this? Is this the breast where we don't do? Yeah. No, for sure.
Exactly.
I hear ya. Cool. Oh, well, we have a few minutes left, but what about lymphatic massage?
I knew you were going to bring that up. I think it's great. I think it's helpful. There's not a ton of people in my area who do it, but we've got a couple people we refer patients to, starting at like a week, and they're like, a week? And I'm like, they're brushing your skin. It's very gentle. Yeah, it's not aggressive at all.
I honestly didn't realize that, but it makes total sense. So there's someone we refer in our community. Well, there's a couple people we refer to, but She stopped by and was like, let me just have you come over to my office so you can see it and you can get a massage, blah, blah, blah. I was like, I won't turn down a massage. Yes. And Kathleen's another person in our community. And I was like, oh, well, it makes sense because you're not doing a soft tissue. You're not massaging muscle, right? You're trying to get the lymphatics. And the lymphatics are superficial. So it is a very gentle,
Right.
8 to 10 days is completely reasonable after a procedure. I do routinely recommend it after liposuction, maybe some tummy tucks. But we had a discussion about how it can be helpful for after a facelift. I mean, there's no reason why you shouldn't do it after any procedure, honestly.
Lymphatics everywhere. Yeah. So especially when people are really bothered by the swelling, I'm like, go get a lymphatic massage. It will help.
It really does help. Yeah. I know. I feel like I think Kathleen and I were on like some sort of Clubhouse when that was a thing for 5 minutes.
Oh, yeah. I forgot about Clubhouse.
And then, and then Dr. Karen Horton was like, it doesn't work. Like, just matter of fact. And I was like, oh, I mean, you might want to couch that with a, like, in my opinion, or not for everybody, maybe equivocate a little bit. Because I feel like, how can it not help? Like, you do it for like a facial or, you know what I mean?
So, you know, when I actually learned about it, I got a lot of hand swelling with all 3 pregnancies, and then I would get carpal tunnel, and then I'd have like my little sausage fingers, and operating was hard. So one of my employees would do like lymphatic massage on my hands for me so I could operate.
Nice. Yeah.
Oh, Dr. Rourke.
Dr. Rourke uses it. Absolutely. So, yeah, I mean, I think it's helpful. It makes sense. The lymphatic system can use all the help it can get, honestly. Okay. And compression helps with that, right? We know that from
because it doesn't give the
compression
skin room to distend, especially those patients where you're doing high volume liposuction. There's a lot of dead space to fill back up with fluid.
Right. Yeah. It's one of my favorite things to recommend. And then people who I do lower extremity stuff to, like thigh lipo or thigh lifts, I have them do legs up the wall too, which I assume everyone knows, but no. So you just like lay on the ground
and put your legs up on the wall.
Your butt a wall, your legs up. It's really, everyone should do it at the end of the day, but who has time for that?
Feels good on your lower back, yeah.
Yeah, it's great for your lower back. It's great for your circulation, et cetera, et cetera. It's just, one more thing. But if you had surgery, it does definitely helps.
Yeah. Wow, you know where we're going to be in 2 weeks? We're going to be in Boston.
Boston. Are you going to that Witches of the Blade dinner on Friday night? Okay.
And then there's a Galaflex dinner, I think, on Saturday, too. Oh, you're going to that? Yeah, because Cindy set it up with Dr. McCord. I'm so excited to actually meet her in person.
Yes, that's going to be great. Cool.
Yeah.
Yeah, and I'm filming some stuff on what day do you get there? Friday? Thursday?
No, I'm coming in Wednesday night because I'm moderating a panel Thursday afternoon, and I'm afraid flights will be crazy. So I'm coming in early. Yeah, I'll be there all day Thursday.
I'll be there. I fly in a red eye, so I get there Thursday morning because I have a Women Plastic Surgeons Steering Committee is at noon. So I will be there so that I can go to that.
Oh, yeah. I wonder if I RSVP'd yes for that.
I will go. You should go.
Thanks. You know what? I'm going to go. I know I RSVP'd for the luncheon. So.
Oh, yeah. That's sold out. So.
Oh, good. Who did the keynote this year? It was so good with Dr. Wendy Chen last year. She was amazing.
Yeah. It's, I think it's Allison Nada.
Okay.
Yeah. She's supposed to be good too. I think it'll be
awesome. I'm excited. It's always great, women.
Yeah. So I will see you in a couple weeks then.
I know. I'm so excited.
Our next thing. Maybe we can talk about things we learned at the annual meeting.
That would be fun. I always learn good stuff.
Cool.
All right. Thanks for joining us.
Have a good night.
You too. Bye.